Hello and welcome to the National Secular Society podcast. I'm Alastair Lichten, Head of Education at the NSS. This is part 5 in a series of interviews where I speak to activists and experts about religious freedom and what it means to them. This is leading up to our major conference in May, Secularism 2019. What does religious freedom truly mean? While some religious lobbyists use the term to demand privileges, this conference will serve to highlight that true religious freedom means freedom of belief for people of all religions and none. If this conversation has whet your appetite, then I hope you'll join us at the Tower Hotel in London on the 18th of May. Tickets are just £50 or half price for our members, and students can even get a ticket for just £10. Today I spoke to Dr Antony Lempert, Chair of the Secular Medical Forum, about the importance and misuse of religious freedom in healthcare. I hope you find the conversation interesting, and I'll be back at the end with a few thoughts. Dr Lempert, welcome to the NSS podcast.
Thank you. Hello.
Do you want to start by telling the listeners a little bit about yourself and how you came to be interested in this intersection between secularism and healthcare?
Sure. Well, my background is as a GP, and I work in a rural practice on the Welsh-English border. And I've long been interested in the rights of people to express their own beliefs. But certainly, I was one of the initial members when the Secular Medical Forum was started in 2006, which was actually started by Dr. Michael Irwin, who initially ran it. Now, I got much more involved when I started to assist him, and then I took over from him in the early 2008. And to be fair, a lot of my understanding of the areas has evolved over the last sort of 10, 11 years, working with other organisations that share similar views in certain of these areas, and also developing an understanding and coming up against some of the barriers and starting to appreciate the depth of some of the problems as religious interference starts to affect other people's delivery of their own personal healthcare, or the other way around, the importance of allowing individual people to have healthcare that's important to them and their own personal beliefs.
What does religious freedom mean to you in a professional or personal capacity?
Well, I suppose in a personal context, religious freedom means simply being allowed to believe what one wants and to put those beliefs into practice without unnecessary restrictions, whilst also being mindful that any one person's personal beliefs will necessarily differ from the beliefs of other people. And it's also really important to be able to change one's beliefs and to recognise by doing so that all religious belief is a choice of the individual. And for me, this is quite a basic point that sometimes goes missing in discussions where people assume that they're intrinsically entwined with their religion and there's simply nothing they can do about it. And if you have that viewpoint, those who do wish to change their opinions or beliefs or thoughts, or even one element of them, can come up against real barriers within the community they've left by people who don't understand that religion, like many other personal positions, is a personal choice, not an imposition. And obviously, as we know, that can lead to, from simple condemnation to really quite significant harm being done to people who choose to change their beliefs. So in reality, it's important to be respectful, allow everyone the space and freedom to believe and practice what they want. But this freedom isn't passive either, and it needs to be worked for, because in some closed communities, for example, the dialogue is closed down such that people don't have the choice of changing their belief. They can't even conceive of a world without those particular beliefs or those practices. Equally, in a wider context, religious freedom sits within the spectrum of freedom of thought, conscience, and belief, which is a fundamental right guaranteed to every single person on the planet by the UN Declaration of Human Rights. And in this way, it's no different from any other form of freedom, and must similarly be constrained by restraints necessary to protect harm to others. And I think it's really important to put religious belief in the same context as other beliefs, because it often assumes or assumes for itself a special place, a reserved place, which is different from other beliefs. In a professional context, freedom of religion means very much just empowering patients to get the medical care that's important to them, and that works both ways. It means ensuring that patients get the care that they choose within a reasonable context of what's legal and reasonable and available, without other people imposing or restricting on that, making unnecessary restrictions on them. And equally, it means allowing religious people to access care that's in accordance with their own personal beliefs, and not having people who disagree trying to stop them from doing something that we might, that some of us might regard as wrong or goes against the medical grain.
And that has an interesting interaction, I guess, when we talk about the healthcare of children, because the religious freedom of an adult to make healthcare decisions which their doctor or their community may disagree with is different to the freedom to make those decisions for another.
It certainly is. Now, ordinarily in healthcare, obviously there are certain people, and children are one of the most prominent among them, who don't have the capacity. Ordinarily, obviously, some children develop the capacity during their childhood, but don't have the capacity to make a decision for themselves. So there has to be somebody, and usually that's the parent or guardian, who makes that decision for them. Now, it's really important, again, to remember that decision is not just plucked out of the air. That's a decision based upon what's being medically recommended. So parents don't have a carte blanche to sort of say, I want this. I want my child to have their face scarified. I want to, for example, chop off their little finger. There's no automatic right of parents to determine everything about their children, because in those circumstances, doctors also have a role in terms of safeguarding children. So there's a balance going on here between what parents want for their children, and what's safe and reasonable, and what's a safe and reasonable decision for them to make for their child. And obviously there are certain contexts in this where this really does come up, where there's a very a very large conflict between normal medical care and what parents want. And I suppose two of the biggest ones, one of them is parents who have a Jehovah's Witness belief, who wish to ensure that their own children don't have a blood transfusion, because they don't believe in a blood transfusion, even to the point where their child's life might be at risk. And one of the other main areas in common practice now is where parents want to perform a ritual cutting of the child's genitals for a religious belief as well. If I may expand a little bit, on the Jehovah's Witness side of things, many of these cases have actually gone to court, because clearly it's quite a difficult area where children's lives are potentially at risk, but the parents' beliefs are so strong, and naturally they do want the best for their child, but they believe the best for their child is by restricting a blood transfusion. And in all these cases that have gone to the courts recently, the courts have upheld actually that the child's right to appropriate medical care is more important. It's just so fundamental that that parents can't impose their beliefs, and it's very different when a person has capacity. So when for example, a 25-year-old person who's life-threatening injury, who perhaps needs a blood transfusion, and says I will not have a blood transfusion under any circumstances, it would be absolutely wrong for a doctor to provide that.
I think it's safe to say that one of the most contentious areas of the Secular Medical Forum's work is your efforts to challenge non-therapeutic male infant circumcision, a practice which is often justified in terms of religious freedom.
That's right. It's intriguing that it is one of the most controversial, because there's no doubt that it is, even amongst some people who are naturally secular. To me, the ritual male cutting of the genitals, or ritual cutting of any child's genitals, gets to the very heart of secularism, because the essence of protecting children from imposed religious belief, what could be more fundamental than allowing an individual person the right to determine the branding, the markings of their own body? The claims that it's a religious right, RIGHT rather than RITE. So these claims that it's a religious right apply to the parents, the community, and in a similar way to the Jehovah's Witness story or to any belief, these beliefs are not formed in infants. So to actually cut any person's body, to make an irreversible change to a person's body solely on the presumed beliefs of this person when they're older, is completely opposite to religious freedom. Because as you get older, you will form your own beliefs. And there are many people who either believe something differently or even choose to believe, both the Jewish and Muslim communities do it, practice this on their children. So some of them will believe in Judaism or Islam, but will also choose not to be cut or not to have their own children's genitals cut. So these claims of religious freedom miss the point of religious freedom. Religious freedom is for the individual. It's not for the community. And as soon as you start getting onto the territory of community religious freedom, you actually end up in a situation where people lose their religious freedom entirely, because the community claims ownership of everybody within that community. And that's precisely what happens with ritual circumcision. Children are cut because of the presumed beliefs of the community.
I think this is a recurring theme in all of the interviews, this misuse of religious freedom as being about a freedom to impose practices on other people. Are there any other areas of healthcare where this is a particular problem?
Well, there are many areas where on a personal level and a community level, individual freedoms are restricted by community claims for freedom. I mean, for example, one of the something that's in the news quite a lot at the moment is the situation in Northern Ireland, where women's rights to sexual health and abortion are completely restricted compared to the rest to mainland UK. So in essence, there were less than 10 women were allowed within the confines of Northern Ireland last year to have an abortion, which is widely recognised as a fundamental part of medical care. And this is based largely on the control on the community by the established religious order, and saying that's not to blame individual people. These are the representatives of the religions, and the abuse of power from those at the top. Many individual people, whether they believe or don't believe, have all sorts of widely varying beliefs, but it's the abuse of power of people who assume that everybody has a conformity of belief, and they use that to restrict other people's rights to access appropriate healthcare.
I mean, obviously, any advocate of religious freedom would have to say that people should be able to advocate and preach against, and disagree with abortion, but to use that, to use a claim of religious freedom to deny someone a particular form of healthcare seems, to misunderstand the purpose of religious freedom.
Yes, and of course everybody should be allowed to have an open dialogue and a debate, but they shouldn't have the power to trump other people's views, because this is what's happening over and over again. People say, well, my beliefs are so strong that I must make sure that these are enforced. Whereas on the other side, people, for example, another area of, say abortion, nobody who is, nobody goes to seek an abortion because they think, oh, that's what I'll go and do today. It's a nice sunny day. They've given it an enormous amount of thought. But equally, none of them will go up to somebody else who's not having one and say, how dare you not have an abortion? There is respect, and it's often going, unfortunately, just in the one direction. People who advocate for individual freedoms mean it on both sides. So, from my perspective, the secular medical forum perspective, it's about allowing people to make those reasonable choices, not forcing anybody into choosing, one way or the other, whether to have one, whether not to. It's a big decision, and women who've got to that point to make that decision have usually given it an enormous amount of thought before they've got there, and they should be allowed to access that reasonable care.
What do you think can be done to help healthcare professionals recognise and maintain appropriate professional boundaries so that they are respecting others' religious freedom but not imposing their own religious views?
Well, in truth, much of the guidance around this area already exists. And I suppose the main thing is to ensure that the regulators themselves don't make exceptions in this area. For example, General Medical Council, which regulates doctors in the UK, provides guidance already, and actually gives explicit guidance on personal belief, and tells doctors very clearly that we must respect those boundaries. We mustn't impose our beliefs on our patients, and we must do everything we can to ensure that patients have care that's in accordance with their own personal beliefs. The real problem comes when people just ignore that for special pleading cases of religion. And again, I come back to the circumcision, where the GMC guidance is very clearly circumvents its own guidance in this area by jumping through hoops to ensure that doctors can ignore the fact that children can't make up their own mind, and children have to, children are intrinsically vulnerable. But on the whole, the guidance is there already, and doctors, it's very clear that doctors should not be imposing our own personal beliefs on our patients. And to be fair, most of us don't. It's only a very small proportion of very religious doctors from certain sections that do try to do this.
I mean, I've never been a healthcare professional, but I've, for instance, worked on a helpline with young people, and where we had very clear guidance on not inserting our own, people may have been motivated by their personal beliefs to give that their time and volunteer at the service, but we had very clear guidance around not bringing our personal views in, and I don't think anyone ever felt that that was violating their freedom of speech or their religious freedom.
No, it's about being responsible. If you're walking down the street and you get engaged in conversation, then you have freedom of speech to say what you want. But if you choose a role where you're providing, well, certainly for medical professionals or other healthcare professionals, you've actively chosen that role, and you have a responsibility to go with that role. It's very similar to a teacher not turning up in school and banging on about their own political beliefs and teaching children that's the only one. That would be an abuse of power in a very similar way. And I think, most people recognise that, but a few people unfortunately feel so strongly about their own beliefs that they think that the greater good means that they must impose their belief because they're saving people, or they're preventing people from doing something so much worse, and they actively avoid following the guidance. And there've been a few cases of that recently.
I think another complicated or potentially complicated area of the intersection of religious freedom and healthcare is around conscientious objection. And I mean, obviously, I think we can all say we wouldn't want someone to be forced to do or to provide a service which goes against their conscience. But if you've opted into being a healthcare professional, what are the limits, or what should the limits be on your conscientious objection, your ability to say, I don't want to do this particular thing or this particular part-time job or serve this particular type of person?
I mean, we'd all recognise that people go into healthcare for a variety of reasons, and everybody has their own personal conscience. And where possible, obviously, we want it's kind and kind on each other and on patients to make sure that healthcare professionals aren't pushed into a position where they feel they're doing something completely against their own beliefs. And for this reason, I would completely agree that medical students in their training shouldn't be forced to participate in an abortion procedure, for example, but should be given the choice to opt out. On the other hand, once that person is qualified, they have a responsibility not to choose an area that's going to bring them in direct conflict with the delivery of necessary healthcare for other people. I mean, this has happened it happens where people deliberately choose a role so that they can obstruct the delivery of healthcare. And unfortunately, we keep coming back to sexual health because many of these issues they're not driven by secularism, they're driven by religious concerns, and religious concerns seem to be centered around personal sexual freedoms such as sexual health, homosexuality, cutting of children's genitals. A lot of them revolve around their obsession with other people's sexuality. So in law, there are a couple of areas where doctors are allowed to conscientiously object. One of them is in the delivery of abortion. The other one is in the Human Fertilization Embryology Authority regulations. And most of us think these are quite reasonable, but should not be extended. Unfortunately, there have been moves to, certainly from some religious people, and there's certainly a bill going through the Lords at the moment from Baroness Alone called the Conscientious Objections (Medical Activities) bill, that would really open the floodgates to allow healthcare professionals to say, "Oh, I'm not going to do this because it's against my belief," and that would be disastrous for the delivery of healthcare, because it's not about where an individual person is delivering individual healthcare professionals delivering the care, but it's about whether the institution itself can deliver the care, and where the care can be delivered by other people reasonably without putting undue pressure on the service. That's fine, but where patients risk not receiving the care that they need, that becomes a big problem, and that becomes the responsibility of the healthcare professionals. And if I may just say, because about 2 years ago, the General Pharmaceutical Council updated its own guidance on this, and they took a very brave stand. They initially thought that the beliefs of the pharmacist who didn't want to prescribe emergency contraception, for example, and the patient should be balanced. And following some challenge, they actually completely backtracked, and they finally recognised, and they updated their guidance to say, the balance must be shifted in favour of the patient, and if a prescription has been written, it must be delivered to the patient, irrespective of the individual beliefs of that pharmacist, who really has a responsibility to choose to work somewhere that's not going to cause a problem to patients.
I mean, if someone were an ethical vegan, we should respect that life stance, but then they probably wouldn't be able to get a job in an abattoir.
Precisely.
Are there any other areas where a mistaken understanding of religious freedom is leading to religion being imposed in healthcare in an inappropriate way?
Well, going back in the past, I mean, certainly the biblical condemnation of homosexuality led to homosexuality being regarded as an actual psychiatric illness, and not too far in the distant past, and certainly in the living memory of many people now, people were offered the awful choice between electroconvulsive therapy, that's shockwave treatment to the brain, or jail for their supposed illness. Equally, in modern times, gay conversion therapy is still being offered as a therapy. It doesn't deserve the word therapy. There is
heavy quote marks.
Yes, there is no evidence whatsoever that people's sexuality can be changed, and in fact, this leads to it leads to awful situations where people brought up in these communities aren't able to be open with their friends and relatives, and then it causes serious mental health difficulties with them. And of course, you can interpret that two ways, but quite often that those who are against homosexuality say, look, these people are mentally ill. Well, yes, if you're in a community which doesn't accept you and which actually actively rejects you, it will affect your mental health, certainly adversely. And the gay conversion therapy is, I mean, as I say, it covers a wide spectrum, but some of it is really quite sinister. If you believe strongly enough that people are absolutely wrong and must have their sexuality changed, people will go to extraordinary lengths to change it. And we've heard stories that people have, been forced into starvation regimes, even forced rapes. I mean, it really is quite awful what happens to some people from some of these communities. And of course, these are some of the most vulnerable because they're teenagers discovering their sexuality, and it's the people they trust and love the most who are doing this to them, and they're doing it out of a mistaken sense of religious freedom. Other areas which sometimes don't get touched on, and which are slightly more on the edges of secularism, things like assisted dying. Now, I think because people can have views for and against assisted dying on both sides of the religious spectrum, some people often assume this doesn't have much bearing on secularism, whereas in fact, much of the push against allowing people the right to make their own decision at the end of life, that their life is intolerable and there's no reasonable prospect of improvement, most of those people pushing against that decision are religious. 20 years or so ago, they used to declare their religion and say life is sacred. Nowadays, they recognize that society is changing, and using those words will not get them very far. So we hear the same people using so-called secular arguments that people are vulnerable and that we don't want to be killing people. And of course, people are entitled to those views if they wish. But the medical profession within the UK has been severely influenced by people with these strong views, many of whom are quite covert about their affiliations with the religious organisations that they adhere to. So I think that's a real issue, and I think it's one of the areas it's quite difficult to challenge on a religious basis, because the people are not openly talking about their religion.
And I must see someone's personal religious worldview, could include the idea that they should be able to control their own life and how it might end, as well. So their religious views, which actually do affect them themselves, could potentially be restricted.
Well, that goes with every single one of these religious freedoms. The bottom line is, if somebody else is imposing their religion on someone else, they are necessarily restricting that other person's opportunity of choice to choose their own beliefs. And that's always the case. And that's why it has to be an individual personal freedom.
I know we've already discussed non-therapeutic male circumcision, but before you go, can I just ask for your thoughts on the newly published guidance for doctors from the British Medical Association?
Yeah, you can have my thoughts, but it's a disaster zone, to be perfectly honest. The British Medical Association is the trade union for doctors and the professional body for doctors, and provides guidance. The updated toolkit for doctors explicitly says that it didn't have access to all the evidence, and it's not an ethical document. Unfortunately, this didn't stop it from making ethical statements and making scientific assertions. Many of the points made within this document contradict themselves. So it's actually an incoherent document. For example, the BMA's new guidance helpfully notes that in the recent cases of a dispute over whether non-therapeutic circumcision was in the best interest of a child lacking competence, the courts have ruled that it was not in the child's best interests, and that children's best interests should best be served by waiting for them to make up their own mind. So they note that, but despite this, the BMA's updated toolkit recommends that doctors who are asked to remove a child's healthy foreskin make a best interest consideration that's almost exclusively reliant on parental beliefs. And this completely subverts normal medical principles. I mean, the new guidance is a completely lost opportunity to remind doctors that the cutting of any child's healthy body for no medical reason is simply not in a child's best interest. And it makes extraordinary assertions such as, circumcision does not need to be performed by a doctor. So the BMA is actually saying there's no need, as there would be for any other invasive surgery, for a sterile, hygienic environment and a competent trained surgeon who's gained appropriate consent. It's difficult to overstate just how different this is from any other piece of medical guidance that's given. And it's difficult to escape the fact that the BMA has actively walked a tightrope and straddled the tightrope, really trying to please, trying not to offend religious bodies, and trying not to understand that actually cutting a healthy, functional, sensitive, erogenous, private part of somebody else's body goes against every single grain of what being a doctor involves.
Well, Anthony, thank you so much for your time today. Before you go, we always like to ask our guests if they've got any recommendations. So, are there any books or films which you think do a good job of exploring religious freedom that you'd like to recommend?
Sure. Well, firstly, I think the book God Is Not Great by Christopher Hitchens is a stunningly good book, which highlights the contradictions and harms of many religions while stating one thing and doing another thing. I'm going to go a little bit sideways here, because one of the things about religious freedom is that people often talk about how it's a special case, and I don't think it is. And some of my other choices really shine a light on the collective madness that often takes over whole communities when people try to speak out with an individual voice. So Catch-22 is one of my all-time favourites, and just the complete madness of they're trying to kill me. Yes, they are. It's a war. 1984, removing the language of change, that works towards preventing people from escaping from the status quo. And that's so common in very strong religious communities. And from the point of view of the film, one of the films that really struck me many years ago, I was actually on a kibbutz as a student, and I was shown the film The Wave, which was all about the classroom experiment in America, how the community it stopped people speaking out, and it became more and more violent and vicious against people who just wanted to share their own personal views and who wanted to challenge the perceived collective orthodoxy of the day, which, in the film was The Way.
It's a true story, isn't it?
It is a true story. And it was a story that was to highlight the dangers of the Holocaust and to highlight the dangers of people not being allowed to have their own personal views, because that's when these harms happen to other people, when the individual voice is lost to the collective.
Okay. Well, we'll share links to all of those in the show notes. Thank you so much for your time again.
Thanks, Alastair.
It's always a pleasure to speak with Dr Lempert, and he's actually speaking at a healthcare conference in Belfast on the 20th of March, and I'm over at the same time to learn more about efforts to integrate Northern Ireland's deeply sectarian education system. So we'll be organising an NSS social on the evening of the 20th. Please message me if you're interested. If you're getting this podcast on YouTube, or you feel like visiting, you may want to check out our playlist from the 2018 Healthcare and Secularism Conference, which covers many of the issues we've discussed today in more depth. Speaking of conferences, there's just over 2 months to go to Secularism 2019, our major conference on the 18th of May at the Tower Hotel. Our lineup of speakers include Rachel Lasser, CEO of Americans United for Separation of Church and State, who I spoke to in episode 2 of the podcast, medical ethicist Dr Brian Earp, who I'll be speaking to in a future episode, and Dr Ahmed Shaid, Special Rapporteur on Freedom of Religion or Belief for the United Nations Office of the High Commissioner for Human Rights. You can find out more about the conference and book your tickets at secularism.org.uk/2019. The conference includes a drinks reception and the award of our 2019 prize for Secularist of the Year, so it really is fantastic value at just £50 and even better value for our members. Links to the books Dr Lempert mentioned will be in the show notes, and if you want to learn more about how the NSS and SMF work together to protect freedom of and from religion in healthcare, please visit secularism.org.uk/healthcare. Until next time, goodbye.